How does the SUDS scale help with PTSD exposure therapy? Imagine walking into a room where you're about to face a difficult memory or situation. How anxious do you feel right now? That's where the subjective units of distress scale comes in. It is a simple tool that helps both the therapist and the person with post-traumatic stress disorder measure how distressed they feel at any moment. The scale runs from 0 to 100, with 0 meaning no distress at all and 100 meaning the most extreme distress imaginable. This quick self-assessment helps guide the therapy process in a safe and effective way. During exposure therapy for PTSD, the goal is to gradually confront trauma-related memories, feelings, or situations to reduce fear and avoidance. The SUDS scale allows the therapist and patient to keep track of how intense these feelings are during each session. For example, if a patient rates their distress as 50 during an exercise, the therapist can decide whether to proceed, slow down, or take a break. If the distress suddenly jumps from 20 to 80, the therapist might choose to lower the exposure intensity or break it into smaller steps. This helps prevent the patient from becoming overwhelmed and ensures the therapy stays manageable. Another key benefit of the SUDS scale is that it provides a clear picture of progress over time. By regularly rating distress levels during sessions, both the therapist and patient can see how much the patient's reactions are decreasing. This process of habituation means the brain is learning that the trauma cues are not as threatening as before. Seeing these reductions can boost motivation and confidence, showing that healing is happening. It also helps therapists decide when the patient is ready to try more challenging exposures, or when it might be time to pause or adjust the treatment plan. The SUDS scale also helps in making clinical decisions. For example, a common goal in exposure therapy is to reduce distress by about half during each session. If a patient starts with a SUDS rating of 80 and ends at 40, that indicates meaningful progress. It guides the therapist on pacing and ensures the patient is not pushed too fast or too slow. This personalized approach makes the therapy more effective and tailored to each individual's needs. Using the SUDS scale also encourages the patient to be actively involved in their healing. Since it is a simple, self-report tool, patients learn to recognize and communicate their emotional states more clearly. This active participation can strengthen the therapeutic alliance and increase motivation to continue treatment. It turns therapy into a collaborative effort where the patient's feelings are central. It is important to remember that the SUDS scale is based on personal perception. Different people might rate the same level of distress differently, influenced by cultural factors or how well they understand their emotions. That's why therapists often combine SUDS ratings with other observations and assessments to get a full picture of progress. This balanced approach helps ensure that treatment is safe, effective, and respectful of each person's unique experience. In summary, the SUDS scale is a valuable tool in PTSD exposure therapy. It helps measure and communicate distress levels, tailor exposure exercises, track progress over time, and involve the patient actively in their healing journey. By providing a clear and simple way to gauge emotional responses, it supports a safe, personalized, and effective path toward recovery. Always remember to consult a qualified mental health professional for personalized guidance and support in managing PTSD.